morning, ma'am. I'm Rowena Doctor from BSN 22 and I'm going to perform assessment of parenteral administration of drugs, intradermal route. And we have the purposes used for allergy testing, tuberculosis screening, and BCG vaccinations. And we have the preparations assessment, assess the appearance of the injection site. And then we have two specific drugs action expected response and client knowledge of drugs action and response. Planning, we have to assemble and organize our equipment. We have the cotton balls and antiseptic swabs. We have syringe, 1 ml sterile syringe, and we have filter syringe, filter needle, and we have the pen and vial or ampule of correct medication. We have gloves, and we have pen and micropore tape. And we have to check the mark of the medication administration order against the label of the ampule or vial carefully. We have to read the label of the medications when it is taken for the medication card before withdrawing the medication and after withdrawing the medications. We have the implementation and procedure. We have to perform hand hygiene to prevent any infection control procedure, and prepare the medications from vial to ampule. And then we have to get our vial or ampule, and we have to check the date and expiration date, and then we have to wait and put it in a flat surface area. We have to aspirate the syringe to the amount we prefer. level, and it is 0.1. And then we have to then cover. Then when preparing our medications, and then we have to prepare the client and check the client's identification band, and we have to explain the procedure to the patient, and he or she will expect, and pain and appearance of a bill or a will. And we have to check the client's identification band, and then we have to explain to the client, sir, you will feel a little bit of pain while performing the intradermal route. And then we have to select the area of the inner skin aspects of the forearm that is not heavily pigmented or covered with hair. There we have to check not covered with hair, and we have to cleanse the site with an alcohol swab by wiping a firm circular motion outward from the injection site. We have to clean the area with antiseptic swab, the circular motion, and then allow it to dry with the skin. Then we have to remove the needle cap with your non-dominant hand by pulling it straight off. Then we have to dot the skin using your non-dominant hand, and place the needle almost flat in the patient's skin, bevel side up. And then we have to insert the needle into the skin so that the point of the needle can be seen through the skin. Insert needle only about 1.5 inch, and stabilize the syringe in the needle. Inject the medication carefully and slowly so that it produces a small wheal on the skin. We have to insert the needle at 10-degree angle at 1 to 8 inch. Then we have to withdraw the needle quickly at the same angle of each inserted. Then do not massage the area after removing the needle. And then we have to discard the needle and syringe and the appropriate receptacle, and do not recap. And you have to remove your gloves and perform hand hygiene. circle the injection site with injection, or circle the injection site with ink, or to observe the wheels. Then circle this one, and then we have to write in a piece of microfour tape the medication administered for the skin test, and due date, time check, and reaction, usually after 30 minutes. Using our microfour tape, we have to write the time, and the minutes. This area, we have to write the time and the due time, and then we have to discard the syringe and the needle in the appropriate receptacle, and do not recap. Here is our receptacle, and here we dispose our syringe or any unnecessary or any sharp object. And we have to evaluate, document the administration's medication, site, time, dosage, route, and nursing assessment. Observe for possible reactions to the administered medication.